break, and in this week's Monday Motivation, sponsored by Gates Brain Health, we have the man himself, Dr. Gates, board-certified chiropractic neurologist and chiropractic physician with us. And today we're talking about what it's like, a day in the life of Dr. Gates, right?
Yeah, exactly.
I'm so curious because, you know, you've been doing this, you just said, for 15 years now.
Yeah.
And, you know, you have this practice of Gates Brain Health, but what goes in every single day?
I think it's always, I'm excited to see patients who are maybe not getting answers elsewhere, because that's usually who's coming to me. And to kind of dig deeper, so to speak, with patients. And it's always surprising, particularly as we do testing and lab work and imaging, to find things, let's say nuggets, that maybe they never would have thought were related to their condition or as causing their condition. So examples would be someone with a dizziness issue, and it just keeps happening, and they don't know why, and they're going to doctor, ENT, audiologists, who are all doing the right thing. And then we find out they have a thyroid problem, or they have an autoimmune issue to their thyroid. And you know, I talk about thyroid issues a lot on this broadcast, not to be redundant or repetitive, but it's a big deal when it comes to conditions like dizziness or gluten, relative to some patients who have balance problems. And so it seems so extraneous and remote, and some people are going to scoff at it and say it's not an issue, and it might not be an issue for some people. But it might be a big issue for some people.
And so I guess, what are you, because every time you come on for Monday Motivations, I feel like I'm learning something new every single time, that gut to mind connection. So what are those hot button topics that you see? You know, you mentioned the dizziness, the thyroid, but what other things should maybe people be looking out for?
Absolutely. So neuropathies are a big one. Neuropathies relative to that connection to foods, and whether it be diabetes, gluten, pre-diabetes, even Parkinson's disease. I'm working with a lot of Parkinson's patients now holistically. We're not anti-medicine or anything like that, but we're finding some really interesting connections between the gut and the brain for Parkinson's patients. MS patients, also working with them in the course of their condition, particularly if it's early, we can do a lot of things. And even if it's later on, we're trying to guide people in the right direction. So really trying to meld holistic with medical referrals is what I do all day long. And when I see somebody who's not getting answers, I really try to say, okay, well, what about this? Did your mom have a thyroid problem? Did your mom have lupus? What may be in the family tree that's predisposing that person to a certain condition?
And it's so great, Dr. Gates, that you personalize, because it has to be. It truly has to be, because you have to look at that family history, or just, you know, start with something, right? So I guess in the 15 years that you've been doing this, what has been the most rewarding part of, you know, finding those answers and, you know, putting that puzzle piece together?
I think it's this continual growing inertia, so to speak, of confidence that there is this piece of diet to neurology, to what you would consider ENT problems. That's what I find the most interesting, because I see it day after day after day, and patients get excited when they're getting better. And that's what's so gratifying.
1000%.
Truly,
Yeah, and you know, any top tips, or if people want to make an appointment with you, how they should
if you want to make an appointment, 775-507-2000, info@gatesbrainhealth.com. We really look at these things, and I encourage patients, talk to your doctor, ask questions. A lot of patients are afraid to talk to their doctor. You know, your doctor is there to help you. So say, what about my thyroid? Have I been checked for Hashimoto's? Have you checked me for celiac disease? What about my genes and memory loss? Can we look into that? And those are conversations. If you're hitting a roadblock, then give me a call.
Perfect. Well, thank you, Dr. Gates.
Absolutely.
Great to see you again for Monday Motivations. We'll have all of his information on our website at colortv.com.
All right.
Be right back.
Cool.